Hi friends. Okay, please let me know as soon as you tune in. Somebody let me know that my audio is working and that my connection is good, because I am having some connectivity issues and I'm also having some headphone issues. So I don't know what's in retrograde, but technology and me are not getting along at the moment. So I'm gonna start slowly. Again, if you're tuning in, please comment, just give a thumbs up that we are all good to with audio and and the video too, that I'm not like freezing and you can actually hear me coming through clearly. So welcome. Thank you so much for joining us, for being here for another episode of Talk Stories. And I'm hosting again today, Seychelle. A really interesting topic, one that I actually finally got some questions about. Every single talk story that I do, I always encourage before and after, of course, but before especially, like, send me your questions. What do you want to know? What do you want to hear about? What's your experience with this topic? Because that helps me formulate what I'm going to talk about. So this one, I can tell, is going to be a good one for a lot of you, because I did get some feedback about wanting to hear specifically this. And so we're going to talk today about some lower back pain, as it refers to paddling, of course. And I want to talk a little bit about pain. I want to talk about tips and techniques and exercises, strategies, practices you can do on the water and off the water to help if that's something that you struggle with. So nobody's commented yet that I'm coming through clearly or not. So yay, there we go, coming through. All right, thank you so much, Susanna. Thank you so much, Tony. Okay, cool. So first things first. I am a professional athlete. I am not a professional healthcare provider or therapist. So this message is not to diagnose, treat, prevent, cure any ailment that you are having. If you are in pain, please stop paddling and seek professional advice from a sports medicine therapist or doctor, a physical therapist, a chiropractor, acupuncture, massage, whatever it is that works for you and that you believe in. Ideally, you find a therapist or doctor that you really work well with, and by work with, I mean they're not just telling you it's this way and this is the only way, and also preferably one who suggests other therapies as well. In my experience, healing from pain, coming from multiple avenues is always the best, and multiple therapies is always the best way to treat your body, to heal. So, and I know this is going to come up, so I'm just going to go ahead and throw it in the beginning. As far as, if you are like seriously injured, and today I kind of want to talk about just like in general, you have lower back pains, lower back, stiffness, soreness, pertaining to paddling. But if you're like somebody who's really messed up and you're, I get reached out to all the time because I had a chronic, traumatic and acute neck injury that did not become chronic back pain, and I did not do surgery. So my stance on surgery, since this was one of the questions I get asked a lot, is that it is necessary for someone who's not willing to put in the time and the work required to heal. It is necessary for someone who's not patient enough to let their body rest and heal, right? So there's always a reason for pain. Pain's a messenger from your body, and it means that there are changes that you need to make to the way that you are using your body, the way that you're moving your body. And healing is a daily effort, and not to throw anybody, to make anyone feel any worse, but I find a lot of people that reach out to me that have had long-time chronic pain, it's often because they're not willing to put in that daily effort and make those changes, because it's healing from a traumatic injury is a full-time endeavor. So yeah, that's my stance on surgery. If it's for you, it's for you, and if it's not, it's not. So for me, it wasn't. But with that being said, like, let's actually talk about paddling. Because I'm not talking about if you're at that level. I'm going to talk about if you're like just a little stiff and sore. So paddling can put a lot of stress on the back, anywhere on the back, the upper, neck, middle, of your back, shoulder, between your shoulder blades, and your lower back, your hips. It's all connected. And this is also just right off the bat answering one of the questions that I got, somebody who was commenting about SI joint pain and saying, well, I thought it was low back, it's actually SI joint. For the sake of this talk, it's all relatable, because the SI joint pain, you are going to feel that in your low back in general, and I'm including that with these tips. So something you definitely want to get checked out, though. Figure out, okay, am I having an issue in my spinal column, or is it in my hips? Is it in my SI? My SI is sacroiliac joint, so sacrum, hips, the lowest part of your spine. So, and then a fun fact, what's going on in related to it's all connected, what's going on in one part of your spine is often reflected in the opposite part of your spine. So what's going on at the very base of your spine is often reflected in what's going on at the very top of your spine, and then it sort of works its way down together like this. So the opposite parts of the spinal column are often, so if you have problems in the cervical, best to check your sacrum and vice versa, right? So the body it's never just one thing. There's always a connected, and it has to do with what I'm going to talk a lot about today, how we're moving our body, how we're caring for our body, and it also has to do with, that's the physical part of it. It also has to do with the metaphysical part of it. So what you're internalizing in your body, your emotional state, your level of stress, because that's so important for your recovery as well. So yeah, so it's not just how, we are moving in our spine, but also in our hips, in our rotation, but also the position that we're keeping our neck in. And what's super, super important is that it's not just how you're moving when you are paddling, and I want to talk a little bit about this today too. What I have found in my experience and in athletes and many others that I've spoken to, that I've worked with, it's often how we're moving when we're not paddling. So the other 98% of the time, how am I moving my body when I'm sleeping? I'm not moving my body, but how my body's positioned when I'm sleeping, when I'm sitting at my desk, when I'm typing on the computer, when I'm looking at my phone, when I'm driving in the car. All these things that we're doing all day long, that has a huge impact on our body's ability to recover from exercise stress, and has a huge impact on feeling exercise stress. So we can load into the back quite a lot as paddlers, and then we can continue to exacerbate that stress or that strain in the body, and that's what often I find causes injuries. Not just anywhere in your body, like elbow, shoulders. I'm just talking about the spine today, but it's looking at, and even if you're just feeling it when you're paddling, look at how you're positioning your body when you're not paddling as well, because it's often the combination. So that's important to know. Okay, now let's talk about paddling. I'm going to refer to at least 2 other talks, maybe more, that I've done. And so, you know, I did a whole entire talk on hip hinging. I did a whole entire talk on pelvic floor and core stability, both of which I'm going to mention today. So I'm mentioning that now. You can find those videos on my page, Seychelles SUP. You just search talk stories and the topic, hip hinging, core stability. Those would be good ones to dive a little deeper into some of these as well. So, oh, last but not least, it's not my way or the highway. As you know, I always like to say this is what works for me, how I think about paddling, how I apply these practices based off of my experience. And there's no exact right or wrong way to do it, so take what works for you. Great. If you need clarification and you want to reach out to me afterwards, even better. If it's not for you, if someone else said something totally different and that works for you, great. Just keep an open mind for today, and let's have some fun. So, yeah, reach out to me anytime. I'm always delighted to help. So, all right. Let's get to when we are on the water, when we are paddling. Let's talk about body position and movement. So, and I'm actually going to do a little bit of demoing. Ow, sitting on a milk crate, that hurt when I stood up. Okay. So, let's see, so you can see my milk crate. Yeah, go all the way back here. And I got my paddle. Just checking out my notes. All right, so when we're paddling, there's, again, no exact right or wrong way to do it, but there's a way to load into your back. And I see this a lot, there's very little bend in the knees, and there can be any level of rounding in the spine. Can you see my upper? You can't quite see my upper body. So in order to maintain, in order to protect, in order to prevent loading into anywhere too much in the spine, we're talking about the low back today, but it's all connected, you want to maintain a neutral spine. And so you want to pay attention, and I totally recommend taking video of yourself, because what you think you're doing and what you're actually doing, when you look at it in slow motion, is often totally different. And what you're doing at the beginning of a race and how you're paddling at the end of the race is often totally different. So have someone take video of both of those times, and also when you're just training and going at a nice pace. So I can, if I'm keeping my legs relatively straight, not necessarily, but a lot of times I'm loading into the back as I come down and up and down and up. I see a lot of this. I see a lot of rounding in the upper body, in the thoracic, in the shoulders. I see a lot of this. So first things first, we'll start at the top of the spine. So back of the neck long, always, no matter what you're doing, sitting, computer, phone, weightlifting, whatever it is, back of the neck long. I see this a lot. I see, when we're paddling, I see this a lot. And this used to be me. And you guys know how in 2019 I switched from using a visor to a headband? This is the reason, because with the visor I had to extend more in my spine to look up, and that was exacerbating the injury that I had. So I switched to a headband so I didn't have to look up so much to keep my gaze forward. So back of the neck long, right? Shoulders, back, chest, up, right? How often do we go here and we go here, and by the time we finish our stroke we're here, and this is so tight here, and I've loaded a lot into my upper back. So back of the neck long, shoulders back, chest up, core stable. Core stable. What I'm aiming for, and I did this fun little trick in the talk on hip hinging. What I'm aiming for when I get down into my position for paddling is that my spine remains neutral. So by neutral, I mean there's no rounding or arching anywhere in my back. I stayed connected to my paddle. So what I'm looking for is a neutral spine. And how I do that, I have to, as you guys are noticing, I'm having to bend more into my legs and load into my legs. So if you experience a lot of pain in your back when you're paddling, or you're quite sore and stiff afterwards, sometimes this is because it's windy from one side or the other, and when it's windy from one side or the other, there are tips you can do. Actually, to talk some paddling in the side wind, look up those will help you. But you do end up muscling it a little bit more in windier conditions from the wind coming from the side or the chops coming from the side. So that's one thing for where I start to feel it in my back, even though I'm really cognizant of keeping a neutral spine and loading into my legs and not my back. Anyways, I'm digressing. If I'm paddling, straight upwind, or in nice easy conditions, I am keeping a neutral spine, even as I'm taking a stroke, and even as I'm coming up and driving myself past my paddle. So I'm bending in the ankles, I'm bending in the knees, and I'm hinging in the hips, so that my spine stays nice and neutral. I don't round or arch in the low back. I see both of those. I'm not rounding or arching in my upper or thoracic or in my cervical. I see all of those, right? So if that's you, again, take video to find out. You're going to be practicing. Okay. Then the other thing that happens is we get here and our paddle is, say the water's here and I'm fully buried. And then what I see is people keep loading, and then you end up like down here. And then you come up and you're like, no wonder my back hurts. I'm like, here, right? There's no reason to ever be down here, except for maybe if it was really windy and you have a super strong back and you're doing it for a short amount of time. Yes, I've seen pictures of myself at the end of the race where I'm down here. But for the most part, there is no reason to be all the way down here. You want to go from here. Once your plate's fully buried, you're fully loaded, spine stays neutral, you want to start coming back up and using the legs to do so. So rather than going here and then keeping on here and then having to come up, you can feel that. Even if you're practicing with me right now, you can feel that. So I hope that's helpful in clarifying how I can load into my legs more and keep my spine neutral and protect my low back, okay? Another piece that comes up with that is keeping a stable core, and not just like the abdominals, right? Not just the six-pack rectus abdominal muscles, but the intrinsic core muscles that are underneath. So the ones that wrap around, transverse abdominis, also the obliques coming in the sides, but the pelvic floor coming in and up, and that being nice and strong, but not over tight. All of those, and especially the pelvic floor, and we don't think about that one. We don't talk about that one as much, especially not with men, which I know are a lot of my audience right now. But this stabilization of the core and the internal core muscles, and the lowest part of our core is the pelvic floor. I guess you could probably argue that, but we don't. That's what's stabilizing the hips, right? And the hips, if my SI joints go out, or my hips go out, and my rotation, because we're also rotating when we're paddling, if that's where I'm paddling on one side a lot, and that can make my hips, right? So the more I can stabilize in my hips and my core, the more I'm going to protect my spine as well, and be able to maintain that neutral spine as I'm lowering down and up. Does that make sense? Is this coming through clearly? And if you want to know how do I do those things, check out those other videos that I mentioned on hip hinging and pelvic floor and on paddling in the side wind and all those fun things. So yeah, cool. I talked about chest up, shoulders back. Oh, okay. And then the last piece I want to talk about when you're on the water is how your breathing matters too. So I've started to practice a lot more and talk a lot more about how we're breathing. But that is, if I'm here and I did this here and I rounded in my upper body and I load, I'm really like compressing my body's ability to get a nice expansive breath and the diaphragm to expand 360 in a 360 degrees and the rib cage to expand. So I really want to think about this is probably more to do with the shoulders than the hips, but I really want to think about that chest up, those shoulders back, and the ability to breathe wide into the body and breathe long into the body, width and depth, because when I'm here, I'm not able to take a complete breath in the amount of time that I need to really be able to get in the right amount of oxygen. I'm not saying this correctly, but when I'm breathing really rapidly. So yes, that's important for low back, because if my diaphragm gets tight, that's going to affect my spine as well. And the opposite of the diaphragm is the pelvic floor, and we just talked about that needing to be nice and healthy too. So breathing, how you're breathing, your posture, not just when you're paddling, but off the water as well. So let's talk about how this applies off the water. Okay, you guys have probably heard me comment before. Okay, wait, I'm just going to answer a question from Jessie real quick. I found that I get more pain on one side than the other. Is this because I'm twisting? So the word I would use would be rotating when we're paddling rather than twisting, but often 100% of people, we're all a little bit off balance, whether that's, most of us have some sort of imbalance, right? So we're all dominant on one side, but you know, from injuries, from being more tight on one side, stronger on another side, whatever it may be, the rotation can cause that. It's very often, Jessie, that we feel things more on one side than another. So I would have somebody take a look and see, is the pelvis a little bit out in the rotation? Could that be from the way you paddle and being more dominant on one side? Absolutely. Without seeing you paddle, I couldn't know, but just know that that's really common, that we experience it on one side more than the other. Yeah, okay, cool. I hope that answers that question. So let's talk about how we are positioning our body off the water. You probably heard me talk a lot about, if you follow me, foundation training. I am not a certified or affiliated with them, actually. So this is just me telling you because it's helped me so much, not because I get a kickback from them. I just love their work so much, and I'm not a certified instructor, so I can't actually take you through some of the moves that I've learned from practicing foundation training, but it has helped so much with my spine health and being able to apply that to my body mechanic health, how I'm moving my body, and being able to apply that to paddling has helped a lot in my injury recovery and prevention. So definitely give those guys a check out, and that goes a lot more deeply into a couple of things that I'm going to talk about now, which of course is the hip hinging. So if that's something you have trouble with, maintaining a neutral spine, when you're paddling, definitely practice that off the water, okay? Because once you're on your board, you're on an unstable surface, and the body just, we're creatures of habit. We're very prone to, and the body's a master of compensation. So you say do it, and it's going to get it done. It's not going to necessarily get it done in the right way. And that's how we can injure ourselves. So practice something off the water first on a stable environment, and really feel that in your body before you practice it on your board. So hip hinging, so that can be, and if you're not somebody who knows about proper body mechanics, and you're not somebody who can work with a mirror and videos online, like get an instructor, a trainer, a professional to watch you, a physical therapist to watch you move, and help you with your positioning. So kettlebell work is really great. Deadlifts, kettlebell swings, and light deadlifts and kettlebell swings, and because that's really going to help you to hinge, and I mean the straight leg kind, not like crazy Olympic powerlifting deadlifts. Work on your core stability, your transverse abdominis, those wrapping muscles. So that has a lot to do with how you're engaging and how you're breathing when you're doing core work. So what's great for that are, breathing, lying down with your back on the ground and really pulling everything in, and then doing not a lot of the crunching and sit-ups, because you'll notice when you do those, the abdominals kind of pouch up a little bit, and in some people they even dome up a little bit. And really, when we're talking about working those inner core muscles, we want to think about keeping this as flat, I can't see my belly, but keeping this as flat as possible. So if you're doing rather than sitting up or crunching up, do prone work, so like planks, but pull everything in from the bottom up and from the sides in, and try and keep the belly flat and not let the abdominals kind of pouch up in the center, and then you'll know you're getting those inner muscles. And I talked more about that in the other video. So core stability, pelvic floor stability, how we're breathing and engaging the diaphragm here and the diaphragm at the base of our body, expanding and contracting, expanding 360 down and out, coming in and up, pulling everything towards the belly button, towards the spine. So actually I've done a talk on breathing too. I've done so much for you guys that if you're ever wanting to, I'm sort of going through a few of these things really quickly, but that's because I've done a whole talk on it. So there was one on athletic breathing, a talk story. You can search that also on my Facebook page, and on the SIC Now YouTube channel. My computer's gonna die, so I gotta wrap up pretty soon. So how you're breathing off the water is important. How you are sitting, your posture. When you're sitting at the computer, when you're looking at your phone, is your head down? Are your shoulders rounded forward? When we're sitting for long periods of time, our hips get really tight. When we're rounded in our upper back for a long time, what both of those things do, and I'll demo that, what both of those things do, when I'm sitting, so I have here, my hip flexors are tight. My hip flexors are chronically tight because I sit a lot. What that does, that pulls this down. When that pulls this down, that puts extra load on my lower back, and it puts me into a bit of an anterior, posterior, a tilt. So when I'm tight in my upper body, that's also going to pull here and put undue strain. And so if this is already strained because I did a hard workout, and then I go and I sit and everything's so tight, especially you can't help sitting, with proper posture, but some of us can't help sit, for how long we have to sit. You want to make sure that you open up the hip flexors. You can use a foam roller. You can do stretching for your hip flexors, and same thing with the thoracic spine. You can do a foam roller. You can do opening for the thoracic spine, paying attention to your posture, how you're breathing, how you're driving. Keep the elbows in when you're typing on the computer. Keep the elbows in when you're driving. That can, yes, it's going to bring you closer to your steering wheel, bring you closer to your computer. But out here, I'm putting more load into the shoulders, into the upper back, right? So, what else did I want to talk about? That's all I have on my notes. What questions do y'all have before I wrap this up? Is that all like landing clearly? On these tips that I have for getting you out of some low back pain, strain, stress, and tension. And then what I talked about a little bit in the beginning, not just the physical, how I'm moving my body, how I'm positioning my body, also what I'm internalizing, my stress, my tension, right? Tension, physical tension, tension, emotional tension. That's all super important. It's all part of your recovery. And it's all important to take time to recover. The harder you train, the harder you want to recover. There's no reason to live in chronic pain. There's no reason, if you're in pain, figure out why. Paddling is not going anywhere. If you got to take some time off and figure it out, do that, because it's going to help your longevity in this sport. And your longevity just being happy in your body, right? Yes, Nicholas, can I do a video on how to stretch your hips? I have done some stretching videos, but I think it is time to do another stretching video. So I would love to do another stretching video, or mobility. We can add some foam rolling in there too. So yeah, great question and suggestion. And thank you so much for being here. Thank you so much, SIC, for having us. If you want more from me, you can check me out on Instagram, on Facebook, Seychelles SUP. You can write me your questions there, and yeah, sending so much love to you all on this beautiful summer's day.